Hello, I'm here to tell you about the Room2Breathe Asthma Home Visiting Program, which is now launched at Delaware Valley Community Health, Maria de los Santos Health Center. Room2Breathe is a home visiting program that provides one-on-one asthma education with the parents or caregivers of children with hard-to-control asthma. Room2Breathe uses the community health worker model. Community health workers are frontline public health professionals recruited from the communities they serve. Our team of community health workers have shared backgrounds, language, race, and ethnicity with the families that they serve. Room2Breathe is 100% free for families and insurance agnostic, meaning families will never see a bill and they can have Medicaid, private insurance, no insurance. Regardless of their insurance status, they can be enrolled in the Room2Breathe program. Our team of community health workers speak both English and Spanish. Plus, we use a telephonic language line to provide services to patients who speak any language. The goal of Room2Breathe is to reduce emergency department visits and inpatient admissions, as well as to improve the quality of life for the families enrolled in the program. Room2Breathe launched in the spring of 2019, and to date is now working with 7 health systems, including Maria de los Santos Health Center. As of this recording in September 2025, over 1,000 families have been served by the program, resulting in over 4,000 visits being conducted by our team of community health workers. Room2Breathe has a number of partners that make the program work. For one, Education Plus Health is our service provider. Education Plus Health is a nonprofit based in Fishtown that maintains a community health worker workforce. We also partner with the Philadelphia Department of Public Health, which provides quality assurance and quality improvement support, funding, and evaluation support. We also partner with Medicaid managed care organizations, which provide referrals of eligible patients who receive primary care at our partnering clinical practices, as well as additional funding for the program. And lastly, we partner with CHOP's Community Asthma Prevention Program. The Children's Hospital of Philadelphia trains our community health workers on how to become an asthma home visitor. Now we'll talk about benefits for families enrolled in the Room2Breathe Asthma Home Visiting Program. The first one is families report fewer asthma triggers in the home. Families state they're better prepared to deal with asthma attacks that might occur in the future, that there's increased knowledge and confidence regarding the asthma medications prescribed to their child. Families are screened for social needs and then referred to community resources. Families state an increased social support by having a community health worker visit them in their home. We engage with care coordination efforts with the primary care team, which we will discuss in a later slide. We also provide better coordination with school staff, for example, if a child needs a medication form or an extra inhaler in the school setting. And just a couple quotes from some parents and caregivers. The first one says, "The information and knowledge were the most helpful parts of the program. Knowledge is power. I have asthma, and there were a lot of things that I didn't know." As well as another parent saying, "I feel like I have a lot of control over my child's asthma because I know how to prepare for it, the triggers, etc." We conducted an analysis of asthma control test scores that the community health workers administer at various time points throughout the program. And of 153 patients, we saw that during visit 1, the first time the asthma control test is administered, the median score is around 18. 20 is a threshold where asthma is considered well controlled if the score is 20 or above. So we see at that first visit, the median score is 18, and then at visit 4, the next time the test is administered, that score has jumped to 21. And then we also see that that score of 21, which is again above the threshold of well-controlled asthma, is maintained at 21. Looking at this data the same way, we see that during visit 1, 1 out of 3 Room2Breathe patients has asthma that is considered well-controlled. And then during visit 4, and then again at the 3-month visit, that number jumps up to 2 out of 3 patients who, according to the test, have well-controlled asthma. So this shows that only after 1 month in the program, the asthma control of patients improves greatly. A recent analysis of Room2Breathe patients who are members of Jefferson Health Plans shows really exciting outcomes. 52.4% reduction in inpatient admissions, which correlates to a 55.4% reduction of inpatient expenses, as well as a 19.7% reduction in emergency department visits. That correlates to an 18.9% reduction in emergency department expenses. I'm providing additional information on the analysis design, but again, the headline of this analysis is patients enrolled in Room2Breathe are admitted to the hospital less and visit the ED less. So what actually happens when a family enrolls in the Room2Breathe program? We've designed a 12-month curriculum that starts with an intensive first month. So during that first month, there are weekly visits, and during these visits, the family starts with a detailed enrollment. So the community health worker gets a lot of information about the child's background, the history of their asthma, conditions in the home. Week 2 is all about Asthma 101. What is asthma? How does it affect the child's body? Week 3 is all about asthma medications, what medications are prescribed, how are they administered, are they being administered correctly? And then week 4 is about communication, communicating back with the child's primary care provider, communicating with the school nurse. And then there are quarterly visits for up to 12 months. During these quarterly visits, as well as during that first month, a detailed asthma trigger walkthrough is conducted, which we call a home assessment. So that's where the community health workers look for triggers around the home and then make suggestions for the family to reduce those triggers, as well as screening for the social determinants of health. So this is where the community health workers will ask about employment, mental health, etc., and then make appropriate referrals to community resources. The program is 12 months long because we know asthma affects different children at different times, different seasons of the year. So a child might be enrolled in September, but it's not until the spring when their allergies start that trigger their asthma. So we'd like to be with the family for a full 12 months because we know that asthma is seasonal or can be seasonal. I'll now talk about additional support for families enrolled in the Room2Breathe program. We have a contract with an integrated pest management company. So for any family with mice or cockroaches, which are known asthma triggers, they can be referred to this company at no cost to them. This company provides exclusion, extermination, and cleaning support. So for exclusion, they'll look for any holes or points of entry that mice or cockroaches use, and they will plug them. They will set environmentally friendly traps for mice and cockroaches and teach families how to dispose of those traps safely. And then for cleaning, they will steam clean in the areas where there are mice and cockroaches, which could include pulling out a refrigerator and a stove and steam cleaning, emptying cabinets out. Then they will educate families on practices to keep the home clean so mice and cockroaches are not attracted to the home setting. And they will also provide guidance for the community health worker how to reinforce that messaging to the family. Community health workers also provide free supplies to families to help reduce triggers in the home, including a mattress and pillow cover, which contains the dust from a mattress or pillow so the child doesn't breathe them in at night, an asthma spacer to help properly take the medication, additional cleaning supplies, pest control supplies, and then vacuum cleaners, air conditioners, and air purifiers are distributed to families who need them. Coordinating care with the clinical practice that Room2Breathe partners with is a major element of Room2Breathe success. With Maria de los Santos, we're lucky to have our Room2Breathe champion as Daniel Serrano. Daniel will provide asthma action plans to the community health worker team for patients that are enrolled in the program. Our community health workers will also reach out to Daniel in terms of updated contact information or clarifying any medication issues, and Daniel can be the go-between between any Room2Breathe patients who are Maria de los Santos patients and their primary care provider if needed. We also engage in regular meetings with Daniel as well as other Delaware Valley Community Health clinicians and administrators. During these meetings, we discuss referral and enrollment numbers, marketing efforts, and we engage in a case review where we will present every single patient who's been referred and is active and enrolled in the program and discuss any patient concerns with Daniel and the rest of the team and work to provide the best care as it pertains to asthma as well as social needs for the families enrolled in Room2Breathe. Now I'll describe the eligibility criteria for patients. Number 1, a patient must receive primary care from Maria de los Santos Health Center. Room2Breathe only serves patients at partnering clinical practices. Number 2, a patient should be between 2 and 14 years old. Number 3, a patient must be a Philadelphia resident. Number 2, in the last 12 months, a patient should have received 2 ED visits or 1 admission for asthma. This is how we determine that their asthma is considered hard to control. And then we had an asterisk here because we really believe that provider discretion should prevail. So for example, if a patient has been to the ED for asthma once and the sick clinic once, that patient should be referred. If they were at the ED twice, but it was in the last 14 months, that patient should be referred. If the patient just turned 15, that patient should be referred. We don't reject patients, but these criteria, especially the age and the utilization, are guidelines for referring patients. And then also adding a reminder that the program is insurance agnostic. So they can be on Medicaid, private insurance, no insurance, it doesn't matter. We have partnerships with Medicaid plans, so if they are members of partnering Medicaid plans, we have agreements to bill Medicaid for the visit, but if a patient has no insurance, we don't care. We want to serve all eligible patients. Speaking of referral sources, Room2Breathe receives referrals in 2 ways. One is from the providers at the clinics that we partner with, which are all listed here in blue bubbles. The other is from the health plans that we partner with that are all Medicaid providers serving the Philadelphia region. So the providers, through their champion, who in this case is Daniel Serrano, can refer patients directly to Room2Breathe. And then we also have the health plans that run lists of eligible Maria de los Santos patients who meet the criteria for Room2Breathe. And I'll talk more about the referral process right now. If a Maria de los Santos provider refers a patient, that referral goes directly to the Room2Breathe community health worker team that begins patient outreach. If a participating health plan refers a Maria de los Santos patient, that list will be reviewed by Maria de los Santos staff to determine if that patient is registered with Maria de los Santos and determine if that is an appropriate referral. If yes, then the Room2Breathe CHW team will begin outreach. The last slide today is an image of the marketing flyer for Room2Breathe for Maria de los Santos staff. So at the top of the flyer, there is an overview of the program, then the patient eligibility criteria, and then importantly, at the bottom, we have the referral mechanism. So providers should open tasking in NextGen, select MDLS _ Room2Breathe _ referral, attach the patient chart, and hit send. That will then be reviewed by Daniel Serrano, who will make the referral to the Room2Breathe program in our HIPAA-secured web form. Thank you all so much for listening to this presentation. Please refer your eligible patients to Room2Breathe for asthma control.